Hi, my name is Tim and I'm an occupational therapist. Yeah, so I went to Oberon High School here in Geelong. At school I didn't know what I wanted to do. I left school and did 2 years of PE teaching. I realised that I didn't really like the teaching side of things, but I love the health and human body areas of the course. I liked working, I guess, one-on-one with people and in smaller groups. And then I discovered occupational therapy. When I was young, I'd never heard of occupational therapy. I first came across it when I was looking at university courses and saw that at Deakin they were offering occupational therapy. I read up on it, went and talked to a few professionals about it and what it was, and I thought I'd give it a go. So really it was a bit of a gamble for me, but yeah, it paid off. So what I do with each patient is I normally go in and gather how they were going before they've had their injuries. I see how they're going now by getting them up, doing activities with them like walking, getting in and out of bed. When you're injured, you can't just do normally. What I then provide is education and I guess techniques, anything that you can think of that you need to do at home. When you're injured, we work out how they're going to do that. The patient's going to do that. Being a local and having local patients, it's easy to build a rapport. I grew up in Torquay. All my family is around here. Yeah, I also love the region because it's pretty quiet. I'm not a big city kind of person, so I grew up on the beach, so being able to go to the beach whenever I wanted was also a big positive. Also, giving back to the community. It's the area I grew up in, so being able to provide healthcare and services to people that, and sometimes you may know them, means a lot to be able to help them out when you can. Occupational therapy, the word occupation, it can mean anything. It's not a person's job. It can be what they like to do. It can be gardening, it can be reading books, it can be going for a run. What we do is very goal orientated. So what happens is a patient will come in, have goals that they want to achieve, whether that is being able to pick up a pen or whether it's being able to garden again. So we guide our therapy according to their goals. So my typical day is starting at 8 o'clock in the morning, getting onto the ward at about 8:30, looking at my list of patients for the day. Being in the acute setting, the patients change fairly rapidly. An ideal day for me would be getting my list, being able to see as many patients as I can, discharging them either home or completing all the interventions that I need to complete and getting people, I guess, functioning at a better level than what they came in at. An intervention is any type of activity that I would do with a patient, whether it be a cognitive assessment, so looking at their thinking and their memory, looking at how well they get in and out of a bed, it can be anything at all. It can be seeing how they make a cup of tea and toast. So that's what we call interventions. So on the ward, I work with my supervisor, who is an OT, and they look after me, and if I've got any questions, I can go to them and talk through things. Also, it's a multidisciplinary team, so I work alongside physios, nurses, doctors. That's what makes everything work. It's working together to get the right result. It's very important to be a team player within the hospital system, and of course being an occupational therapist. Your communication skills have got to be right up there to be able to communicate how a patient's going, communicate to the patient how and what you need them to do, and then communicating back to the rest of the team what you've done, how the patient's going, and whether or not they're okay to go home or other options after that. So currently I'm a new graduate. The wage I receive is very good for a new graduate. There is definitely room to move. Each year you go up a pay bracket, and right now I'm a grade 1 and there's room to move up until a grade 4 or so. Occupational therapy, it's a very diverse field. You can work in stroke, spinal injuries, mental health, neurological conditions. It's very diverse and there's a lot of different areas for everybody. Anybody's interest is catered for. So to be successful as an occupational therapist, you need to have good communication skills, good people skills, enjoy working with people, and have that ability to build a rapport with someone. Occupational therapy, it's a profession I really enjoy, and I can see myself staying in this profession for a long time.